Hello, and welcome to the West Virginia EVV Time for Care and NPI Update webinar. Today we will go over an NPI numbers, what they are and why you need one, what is EVV, how to download the Time for Care application, the employee processes and employer processes that will change with the implementation of EVV. Let's begin with NPI numbers. What is an NPI number? The NPI is a National Provider Identifier and is a unique 10-digit identification number issued to healthcare providers in the United States by the Centers for Medicare and Medicaid Services. This number will be your personal identifier for using EVV and for service provision in the Personal Options Program. Basically, anyone who is described as a healthcare provider may be required to have an NPI. How can you get an NPI number? Public Partnerships has worked with BMS to provide an easy method to obtain the NPI number. We will obtain some additional identifying information regarding you and then apply for the NPI number on your behalf. In other words, rather than you submitting a paper or web application, we will obtain the NPI for you via the submission of an electronic file. PPL does require some signed forms immediately to complete this process, and we'll look at those later. What if you already have an NPI? If you already have an NPI number, you can contact customer service or your resource consultant to provide your NPI number. We will still be required to complete a provider agreement form so that we can provide this number to the state. Why do you need an NPI number? Well, the NPI numbers are required effective March 1st, 2021 for providers who do not live in the home of a participant. Without this number, providers will not be able to be paid to provide services once EVV begins. Participants can then risk going without services until the NPI number is obtained. The two forms that public partnerships will require are the NPI consent form, or the information contained within this form, and the Medicaid provider agreement. You should have received this consent form in the mail if you were required to complete it, and you can complete it and return it via mail or by DocuSign, or you can provide this information to customer service or your resource consultant over the phone. All providers are required to sign the Medicaid agreement. We cannot obtain this information over the phone. It can be signed electronically and using a fast and easy method called DocuSign. Your resource consultant can help you with that if you would like to do it in this method. All that is required is an email address. If you prefer to complete the paper form, then you will complete your name and your signature, and we will complete all additional information before providing this to the state. If you have an NPI number already, you can include your number on this form. Let's talk a little bit about EVV in the state of West Virginia. EVV are regulations that are put in place in December 2016 when Congress passed the 21st Century Cures Act. The Cures Act created new regulations requiring an EVV system to capture employee time for all home and community-based services, including self-directed programs such as the West Virginia ADW, IDD, and TBI programs. EVV stands for Electronic Visit Verification and is a federally mandated requirement for each state to comply with starting January 1st, 2021. The Cures Act required the following elements to become electronically verified: the type of service being performed, the individual who is receiving that service, the date of the service, the location of the service delivery, the individual who is providing the service, and the time the service begins and ends. Our response to the 21st Century Cures Act mandate was to expand the functionality of our application, Time for Care. Time for Care is our mobile time entry and approval app, already used by hundreds of thousands of individuals across the nation. If you've already used Time for Care, then you know how easy it is to submit your time. The Time for Care EVV mobile app is now tailored to self-directed home care programs and would allow employees to clock in and clock out and also record their time and location. The app records a location at the time of clock in and clock out and does not record locations at any other time. The Time for Care mobile app is a free software application, and it works on any GPS-enabled mobile device, including smartphones and mini tablets. It is fully integrated with our financial management services and our Better Online web platform. What are the benefits of using the Time for Care app for EVV? For the person receiving services, EVV will help provide peace of mind and help ensure that you receive services during the hours that you need care. It also encourages better accountability during work hours, which can often lead to more consistent care. EVV will also provide real-time alerts so that you can receive a notification when you have hours to be reviewed. For your providers who are providing services and support, EVV and the Time for Care app allow for easy time entry where you can enter time on the go as the shift is occurring. It can save you time because you can more quickly record your time and service details directly in your smartphone without a computer or a fax machine. And it reduces error. Time for Care lets providers know in real time if there are problems with their entries. Here are some frequently asked questions about EVV and the Time for Care application. What if you don't have a current username and password? That's easy. You can create one in the Time for Care application or at the Better Online web portal today. The username and passwords are the same for both systems. What if you forget to clock out? So if you forget to clock out, the system will keep running and you will have to manually adjust your clock out time at a later date. You will need to go in and edit the time manually, and remember, manual entries are not considered to be EVV compliant. What happens if you forget your cell phone, or maybe it dies or runs out of battery while you're working? If you're unable to clock in or out because you forgot your phone or the battery has died, you can create a manual entry either using the app at a later time or the Better Online web portal. Again, manual entries are not EVV compliant. What if you don't have a smartphone? If you do not have a current smartphone, you can investigate utilizing a Lifeline phone, or you can inquire about the use of telephony in your member's home. How does the Time for Care EVV app work if you don't have internet access or it doesn't really work well at your member's home? If internet access is patchy or unavailable, our Time for Care app works in what's called an offline mode. So you would open up the phone and open up your app while you do have service. And then when you're in an unavailable area in an offline mode, you would still be able to clock in and out. And when you return to an area where you do have service, the app will submit your time recorded in offline mode. This is considered EVV compliant and can be utilized for areas where there is poor or no service. What happens if you forget to turn on the location services? Will it still let me clock in and out? Your phone is going to provide a pop-up message asking you to turn on those location services. If that happens, you will need to turn them on so the app is able to capture your location, and if you do not turn them on, it will prevent you from clocking in and out. What do you do if the location is not quite right when you clock in? That's okay. Go ahead and clock in and you can enter a note for that shift. Does it cost anything to use the Time for Care app? Our app is free to download, although standard data plan rates may apply depending on your phone plan. Is there a way to see all the hours you've worked during a certain time frame? Of course. You can always view your total hours worked within a pay period by going to the pay period menu option on the app. You can also view your hours worked in our Better Online web portal. We'll look a little bit more at those screens later on in the presentation. What happens if your member wants to go to a different location during the shift? For example, you often visit with friends or family. The application captures your location at the point of clock in and clock out. So if you're at a different location, it's just going to capture where you are. Go ahead and proceed with your clock in and clock out. Don't change that behavior. Let's review some common concerns about using Time for Care or EVV. Does EVV require any audio, photographic, or video monitoring? Absolutely not. EVV does not monitor your device. A GPS location is only captured at the time of actual clock in and clock out, and that is all. Are the members required to carry a monitoring device on their person? No. The employee will be required to clock in at the start of their shift and clock out at the end. An employee's location is only captured at the point of clock in and clock out. It is not tracked during the shift. Will EVV restrict the locations that a participant may receive services? No, the implementation of EVV does not reduce or change the locations where participants may receive services. EVV does not change program rules that continue to allow services to be provided in the home and the community depending on your program. How will service details be collected through EVV? How will they be stored and kept safe? All of our data is stored in a secure server that is routinely managed and maintained, and it complies with all cybersecurity regulations and HIPAA laws. How can you be EVV compliant? Here are the methods of EVV compliance. Time for Care is fully compliant with EVV rules and captures and verifies all the required information, including the type of service, the date of service, the individual receiving the service, the individual providing the services, a real-time shift clock in and clock out, and the location of the support or care worker when they are clocking in and out. Telephony is an alternative option that requires a landline telephone where you can call into the system and clock in and out at the member's home using telephony. The exception for West Virginia to utilizing EVV is if you are a live-in provider, meaning you live in the home of the person you are providing services for. Those providers are not required to use EVV and are considered compliant using current time submission methods. The EVV Live-In Exemption, or LIE, allows providers that live in the home of the participants that they serve to be exempt from utilizing EVV required clock in and clock out methods. The employee must hold the same physical address as the participant in order to qualify for the exemption and have completed the FSLA exemption form. If you need help with this form, you can obtain it from your resource consultant at any point in time, and EVV changes will be reviewed with you even if your current employees qualify for the exemption. Important points to remember about EVV are that you have to clock in and clock out in real time to record the time you work. The location is captured at the clock in and clock out. The location is not tracked during the shift, and paper timesheet submissions will no longer be accepted for those requiring EVV compliance. Let's talk a little bit about how to download the app. The Time for Care application can be found in any of the app stores, whether you utilize an iPhone or an Android phone. If you use an iPhone, you're going to go to the App Store, select Search at the bottom of the screen, type in Time for Care, and that's T-I-M-E, the number 4, and Care, C-A-R-E. Then you'll just select Get and install the application. If you're utilizing an Android device, you would go to the Google Play Store, search for Time for Care, and select Install. Let's talk about a little bit more what it's going to look like as an employee using Time for Care and EVV compliant clock in and clock out methods. The Time for Care sign-up process for employees who do not have a username or account for Time for Care currently is to open the Time for Care application on your device, tap on Sign Up. You're going to choose West Virginia for your state, your particular program that you provide services in, and you're going to select Employee as your account type. Then you'll enter your provider ID, your last name, and your social security number. This will then allow you to create your user ID and password, select your security questions and answers, and confirm your information. Then you'll accept the user agreement and you're ready to go. If you already have a login for the Better Online Web Portal or for the Time for Care app, that's the same login and username that you'll continue to use today. So you're going to go to the Login or Sign Up screen, and you'll see the following menu and features. Once you've logged into the application, you'll be able to see your hours, where you can manage your daily entries and add your time, your pay periods, where you can view all your entries grouped by pay period, the notification screen, where you can view important messages, offline times that allow you to view entries that are recorded in an offline mode, and the More feature. In the More feature, you can access lots of information about us, contacting us, setting up Touch ID, and you can also click to log out here. Let's go over how to clock in and begin recording your time. Once you're logged into the Time for Care application, it is going to bring you to the current day. You're going to click on Add Time from the Hours screen and select who you're working for. If you work for multiple participants, be sure to select the right participant for the day that you're currently providing services. Then you're going to click on the service you're going to be providing to this person. Next, click on Start Time to record your visit in real time. Then your clock is running and you're ready to go. You can turn off the app or even log out at this time. Another option you'll have from the screen is to manually enter time. You may select manually enter time if you forgot to clock in and out for a previous shift. Again, this will be flagged because it is not EVV compliant as your location is not captured. Let's talk about how to clock out. Say you finished your shift, you're going to open back up the time for care application. If you've left it open and didn't log out, you'll just go back to your screen. If not, you'll go follow the same process to log in again. You're going to then go to your currently running time. You're going to tap End Time, the orange button at the end of the visit, and then you're going to tap Submit once you have reviewed your visit information and verified it all to be correct. Let's say we want to look at our pay periods. You're going to log into the Time for Care application and go to the pay period screen. Tap the arrow next to your name to view the time entries for another person, or tap the right or left arrows next to the calendar date to select another pay period. Tap Entry to view or edit if you want to edit an entry. When you look at your pay period time entries, you're going to see different entry statuses. The orange entry status of needs approval means your time has been submitted to your participant and needs to be reviewed and either approved or rejected. A green check mark means the participant has reviewed and approved your entry. And rejected means the participant may have rejected that entry for some reason. You'll be able to click on the entry for additional details and be able to edit it and resubmit it. Other Time for Care features are the notifications feature. There'll be a number of new notifications indicated in a red circle, and you can tap on those to view them. It will be things like showing that your time had been approved or rejected and that your timesheet has been submitted. You can also tap on the More, which is the 3 buttons at the bottom of the screen, and then you can go to About Us, Contact Us, Touch ID, or to log out. If you want to set up Touch ID so that you don't have to type in a password every time, you can click on that and enable or disable the Touch ID. Let's talk a little bit more about offline entries. Offline time entry can be used when you are in a location that does not have good internet or cell phone services. You can clock in and out without a connection. Entries are stored and automatically uploaded once you reconnect, and these are considered to be EVV compliant. To add a new entry when you're offline, you follow the same steps you would as to clock in when you are online. Time entries that are recorded when you are offline can be viewed by clicking the offline times in the bottom menu. On the hours screen, an offline entry will show as not yet submitted and will note that it is an offline time. Once your connection is reestablished, those entries will automatically upload and you will receive a confirmation message under the notifications. Telephony is another EVV compliant option that can be utilized when a cell phone or other smart device is not available or service is poor and the preference is to use telephony. The participants and employees must be registered in the PPL web portal to be able to utilize telephony, and the phone number for the participant must match the demographics in the Better Online web portal. Both the participant and the employee will need a username and password, and if there is no account created, the caller will receive a message stating, "We're sorry, we're not able to validate your information. Please verify your information and try your call again later," and will not be able to proceed. Participants and employees would call in from the landline phone number registered to the participant's account. This must be a true landline and cannot be an internet or cable provider phone line. If an employee is not currently clocked in, the telephony system does default to clocking in for the current date and time. If the current date and time is not for the current shift, there are options to manually enter the start time, including a past date, and the option to manually enter the end time for a previous shift. Note, this is also not considered EVV compliant and is very much like completing a manual entry via the app or the web portal. It will be flagged as non-compliant. To be compliant using the telephony option, you'll need to clock in at the beginning of your shift and clock out at the end of your shift. If you have rejected time entries that have been returned for correction, you will hear those when you call in and they will appear first. If you do not want to correct the entries at that time, then there will be an option to continue clocking in. Let's go over some steps of how to actually use the telephony option. Here's how you would clock in. Each program has a specific number called an IVR number that is utilized for telephony in that program. When you dial into the specific program number, you'll first hear, "Thank you for calling Public Partnerships EVV IVR service. Please listen carefully." Press 1 if you are the individual delivering care and need to submit time. Press 2 if you are the individual receiving care and need to review time. So for providers, you would press 1. Then you're going to select, after you've selected option 1, you're going to use your keypad, and it's going to request that you enter your 8-digit date of birth. For example, if you were born July 1, 1998, you would press 07011998. After the system confirms this, it will request that you enter the last 4 digits of your Social Security number. Then, if you work for multiple participants, it's going to ask you to select the individual that you are now delivering care to. Press 1 for participant A, press 2 for participant B, etc., etc. Once you've selected the right person that you're providing services for, it will ask you to select the service that you will be delivering. A list of services will be provided with the numbers provided for each service. Press 1 for service code and description. Press 2 for service code B and a description, and etc. So it will provide all the different available services that you're approved to provide and ask you to select the right one. It will then confirm that you've selected a particular service code and description, and you'll press 1 if this is correct. It will then say your start time is, for example, March 1st, 10 a.m. Press 1 if this is correct. Press 2 to manually enter your start time. So if you were supposed to start earlier in the day and you had forgotten, that's when you would manually enter your time, but again, that is not EVV compliant. So if you press 1, you'll hear "Thank you. Your start time has been submitted. End of call. You are now clocked in, and you will remain clocked in until you call back and clock out and end the shift." If you press 2, you will be prompted to manually enter your time. Now that you've completed your shift and you're clocked in, you will then go back and clock out to the end of your shift. Again, you dial the same West Virginia program specific number, and it will recognize that you're currently clocked in. It will say, "You're currently clocked in. Press 1 to end your current shift." And then it will provide your end time, the current date and time. You will press 1 if that's correct, or 2 to manually enter that time. If that is correct and you press 1, it will then respond with "Thank you. Your end time has been submitted. End of call." If you press 2, then you will follow the prompts to manually enter the date and time. This is how the telephony systems collects your clock in and clock out for each shift. If you have a past shift that you need to enter that you have forgotten to enter previously, you will be able to follow option 4, and then you will be able to select option 2 to manually enter their start time. So it's going to ask you if you'd like to clock in for the current date and time, and then you would not press 1, you would press 2, and then it's going to request that you enter the 8-digit date you're working. For example, July 1st, 2019 would be 07012019, and then enter the 4-digit time that you began working. For 7:30 a.m. or p.m., you would enter 0730. The system will then request if that's a.m., press 1, or p.m., press 2. It will repeat your start time back to you and ask you to press 1 if this is correct, or 2 to manually enter it again. Then you will proceed on with the prompts. If you're ready to enter your end time, it will ask you to press 2 if you would need to enter end time, and otherwise you would just press 1. If you press 1, your call will be ended. If you press 2, you will follow the prompts to manually enter your end time. You can also manually enter time on the time for care application. Manual time entry is used only for retroactive entries or edits, and if you need to enter time for a shift that has already occurred in the past. The option is available, but again, it is not EVV compliant and should only be done on an exception basis. So you will log into the time for care application. You would search for the correct date and time using the calendar at the top of the application. You'll then select the participant who you're entering time for, the services, and then you would manually enter your start and end time. Then you will affirm that that is correct and click on Submit. Time can also be submitted via the Better Online portal from a manual entry. Again, this is not EVV compliant and should not be utilized unless there's an exception. You'll log into the Better Online web portal just as you do today, and you will go to the time entry section. This will look different from what it looks like currently once EVV becomes implemented in West Virginia, and you will have time entries as opposed to a time sheet. You would then click on Add Entry, and you would be able to select the participant, the service, and the hours worked. Remember, the time entries page should only be used if you are unable to use the Time for Care app to clock in or out in real time. Entries added or modified on the web portal are not considered to be compliant. We spoke a little earlier about Lifeline phones, and Lifeline phones are available to qualifying consumers throughout the United States. The qualifying programs according to federal guidelines are Medicaid, the SNAP program, SSI, the Federal Public Housing Assistance Program, Veterans Pensions or Survivor Pensions benefits, and many tribal programs. If you are not in one of the above programs, you may also qualify by having a total household income that is at or below 135% of the federal poverty level. The resource consultants can provide information on how to get more information about Lifeline phones. However, they will not be able to complete the application process with you or assist with any Lifeline phone or data issues. This is just information that's provided in the event that you need a smart device to be able to complete EVV compliant clock in and clock out and would like some support in how to find one. Now we'll take a look at Time for Care and employer processes. The Time for Care sign-up process for a participant or authorized representative is the same as it is for a provider. You can create a user account for Time for Care in either the app or at the Better Online web portal. Open the Time for Care application on your device, tap Sign Up, choose West Virginia, select your program and consumer as the account type, enter your ID, last name, and social security number. And again, if you're an authorized representative, you're going to enter the participant's information. You will then create your user ID and password, select your 3 security questions and answers, confirm all your information, accept the user agreement, and you're ready to go. The time entry approval methods that are available to participants and representatives when using EVV are the Time for Care application, the Better Online web portal, or telephony using a landline telephone. First, let's look at the Time for Care application. As the employer of record, you're responsible for reviewing the worker's time entries for accuracy and ensuring those entries are submitted that they're correct before you approve them. If it's not correct, you're responsible for rejecting the entry so that your worker can resubmit a correct entry. Accurate time entries should be approved on or before the due date for each pay period. Remember, the pay periods have not changed for any program. Those are still due on the same dates. To approve an entry, you're going to tap an arrow next to the name to view the time entries for that provider, and then right or left arrows to move to different calendar dates. We'll go into it in more detail next. When you approve a time entry, you have the option to approve individual entries or approve all or reject all selected entries. So you can click on one single entry and approve them, or you can click on one single entry and reject it, or you can approve them all. You will have to confirm that you're approving all entries. It will say, are you sure you want to approve these entries? Yes, approve. And then for the selected entries, you'll then select OK. To reject an entry, it's very similar to approving an entry. You would just select the entry that you would like to reject by clicking on the checkbox to the left of the entry and then selecting the Reject Time button. You'll be able to provide information on why you've rejected that time so that your worker can correct it to the accurate time entry. The Better Online web portal is also available for time approval, just as it is today. It's the same portal that you currently use with the same username and password to log in. However, there will be a few changes. The Timesheet tab will now be a Time Entries tab, and all time can be reviewed by shift or by the submission due dates. The time review and approval dates, again, do not change. You can continue to use your same payroll schedule. This is a view of what the Better Online web portal will look like with the time entries view. So you will see the time entries You will be able to search by pay period, and you'll be able to see for your provider how many hours they've submitted and how many hours need approval. Once you click into that actual provider, you will be able to see all of the entries that they have submitted, and you can select them all or select individual entries and approve the selected ones or reject the selected ones. Again, on the time entry search screen, you're able to select all or select individual shifts and hit Approve Selected or Reject Selected to approve or reject your workers' entries. You can also approve time using the telephony option. For the telephony option, you'll call the West Virginia specific program number to log in. It will say, "Thank you for calling Public Partnerships EVV IVR service. Please listen carefully." You will press 2 as the individual receiving care who needs to review submitted time. After you've selected option 2, you'll use your keypad to enter your 8-digit date of birth. For example, if you were born on July 1st, 1998, you would press 07011998. Then you'll be instructed to enter the last 4 digits of your Social Security number, and it will talk you through which employee's time you'd like to approve. Press 1 for, and it will say your employee's name, employee A, or press 2 for employee B, etc. Once you make a selection, it will ask you to press 1 if this is correct, or press 2 if this is incorrect. If there are no submitted entries that need to be reviewed for your selected employee, it will say there are currently no submitted shifts that you need to review, and will end your call. If there is at least 1 submitted entry for the selected employee, it will tell you how many time entries you have to approve. It will then announce to you the following shift. So, for example, this respite shift was provided on 10/12/2020 from 8 a.m. to 5 p.m. Press 1 to approve this entry. Press 2 to reject this entry and return for correction, or press 3 to hear the shift details again. Once you have made your selection, it will either ask you to select the reason you've rejected the entry, or say thank you, your entry has been approved. If you have additional questions about information regarding EVV or the Time for Care app in general, you can always visit our Public Partnerships website at www.publicpartnerships.com. If you go to the EVV tab there, you'll find all the information you need in general about EVV and Time for Care. You can additionally contact Public Partnerships for additional support or information about EVV. If you have questions about Time for Care, you can call the EVV Help Desk at 1-833-204-9041, or you can email the PPL EVV Help Desk at PPL_CS_EVV@pcgus.com. You can always contact your resource consultant as well at their individual number. The customer service contacts for each of our programs are as below. For the age and disabled waiver, you can call 1-866-429-3465. For the intellectual and developmental disabilities waiver, you can call 1-877-908-1757. Or for the traumatic brain injury waiver, you can contact 1-877-908-1755. Customer service is available to assist with questions about the Time for Care app and using EVV, as well as your resource consultant, and the EVV Help Desk is available for more technical issues. This concludes our presentation on EVV, NPI, and Time for Care in the West Virginia program. We hope this has been beneficial and helpful for you all who were not able to see our live webinars. Thank you all and have a wonderful day.